Hi, my name is Beth Quinn, and I'm here with my patient Katie Quinn to demonstrate some upper extremity shoulder mobilizations for my course. This patient presents with significant upper extremity limitations due to prolonged immobilization after a forearm fracture, and so we're going to work on addressing some of these issues today. This patient, we're first going to start with her shoulder and kind of work our way down. She's currently presenting with shoulder stiffness, which is more of the problem than pain. She rates her pain about a 3 out of 10 in her shoulder. So her range of motion limitations that she presents with is flexion to about 90 degrees, so we can get her into about 90 degrees of flexion, and then we get to her in range. About 90 degrees of abduction, and then get her in range, and then her internal and external rotation. Her internal rotation, she can get to approximately 60 degrees, and then external rotation limited at about 30. So we're going to work on some different mobilizations to address those limitations for her shoulder. Because she is presenting with primarily stiffness and range of motion limitations, I'm going to demonstrate some grade 3 and grade 4 mobilizations of her shoulder. Now, with a real patient, being that she did have significant pain in other parts of her extremity, it might alter things. So first I'm going to address her flexion limitation. Okay, she can currently flex to about 90. So we're going to start with doing some posterior humeral glide mobilizations. So I'm going to get her in the open pack position for this patient. I can kind of feel some anterior posterior mobility. Okay. And so what I'm first going to do is work on just a posterior glide. I'm first going to go through and feel her full range of motion. I'm keeping her at a nice neutral head. And with a flat palmar compression, we'll do the full range of motion, okay? So to get that grade 3 and 4 mobilization, I'm going to go to that in range. For grade 3 mobilization, I'll do some large auscultation in a posterior direction. I've got my forearm pushing in that posterior direction, that posterior, and then for grade 4, we go down to that end range and provide some small auscultation mobilization. Is that okay? And after that, of course, I want to reassess her range of motion and see if it's any better. Next, I'm going to look at her abduction, okay? So she's limited right now to about 90 degrees. So to help with that, I'm going to do an inferior glide, inferior humeral glide to work on that. Now, I could also initiate this in an open pack position, but for this one, I'm going to pre-position her at 90 degrees. So that's about where she gets to the end range limitation. With a palmar grasp too, I'm going to work on getting to that end range. So I can feel her full range here. I'm going to go and do large auscultation for grade 3. Okay. And then for grade 4, end range, small auscultation. And then with that at the end, of course, I'm going to reassess. What do you know? She's got my range of motion. All right. Next, we're going to look at her internal rotation. Now, I'm also going to do a posterior glide mobilization with this as well, but I'm going to do it really working on promoting internal rotation, okay? So she can get to about 60 degrees. I can see her humeral head starts to translate up. So we're going to get to that. So I'm going to come in here at a different angle. So I can not only work on the accessory movement, but then also get some physiological movement in here as well. So I'm going to get her to that. Pre-position her to the point where she gets to the end range and work on some posterior mobilization. I'm going to go ahead and just go straight to the grade 4 because I know her limitations. And as I'm doing this, also work on some of the physiological range of motion working towards internal rotation. You okay with that?
Yeah.
So I'm working as she comes down to work on increasing that internal range of motion. Good. Okay, she said it feels good. For the last mobilization, I'm going to have her flip over to her belly. Now, according to Dr. Perry, this position isn't used quite as much, and I'm going to flip shoulders just for the sake of the videotape. So can you lay down We do have a nice treatment table so she can position appropriately with her, keeping her head in a neutral position. For this one, we're going to do an anterior mobilization to work on increasing her external range of motion, or external rotation range of motion. Now, there are some studies that indicate that a posterior glide is also still appropriate for that, given that it can still help with external rotation with adhesive capsulitis. But for this, I'm going to demonstrate what that posterior glide would be. Okay, so again, I'll provide just a little bit of distraction and work on just that anterior grade. So I'll go through the full range and see where my range is. So go into the grade 3, which is about the last 50% of available range of motion, large amplitude or large auscultations. And then going on to a grade 4 at that end range of motion. Now, I would definitely want to be sure that she has a stable shoulder, given that she's been immobilized for a while. I wouldn't be concerned about any instability with that shoulder. All right. So for the next one, we're going to move down to her elbow. Now, this particular patient is. Go ahead and scoot. Can you scoot this way just a little bit? Okay. She's got short arms here. This particular patient is also dealing with. I'm going to rest it there. Dealing with severe pain in her elbow, okay? Really limited to about 15 degrees both elbow flexion and extension, and 8 out of 10 pain. So really we're going to stick to grade 1 and 2 mobilizations for this. So really we might even keep her, since she's already prone, we're going to keep her that way, but we're not really focusing as much on range of motion as we are pain modulation, okay? So with this, we're going to work on putting the pressure into the olecranon fossa. Because of her size, she's pretty well supported in a neutral position here in this position. So I'm going to support this and really just work on just in grade 1, grade 2. So grade 1 is just barely breathing, barely moving it. And grade 2 might be some larger auscultation. Now we're going to go back to treating her left upper extremity. Yep, you're good.
I was done.
She does have a few creases on her face. All right. So the next one we're going to do is the elbow scooping. Okay. So we're going to work on elbow flexion. Okay. So she's pretty significantly limited. She's stuck at about 90 degrees, with only about 15 degrees. And again, pain being her primary limitation. So I'm not going to be doing aggressive mobilization with her elbow, mostly working on pain modulation. So I'm going to come in here and scoop here. So she has about 15 degrees range of motion. Provide some gentle distraction. So I'm going to just do grade 1. And then grade 2, which is the first 50% range of motion. I'm not really going to be providing any accessory physiological movement. And I'm also going to be very mindful of my body mechanics. With this, I do have the ability to adjust my mat, so we can go a little bit higher. But she's in a nice relaxed position here. Now, because we're really, her elbow is the most significant pain, we're going to be addressing that pain modulation. Now I can provide some additional supination, pronation, just some loose movement like this, just to work on controlling that pain. So we're not really working on pronation and supination range of motion as much. We're just providing some relaxation to that joint. She looks nice and relaxed.
Wink.
All right. Finally, we're going to work on the wrist. Okay, so she, again, does not have as much pain issue with her wrist movement. It's more range of motion and stiffness limitations involved in that wrist. So we're going to work on first just some wrist flexion and extension. She's limited to about, again, 15 degrees on either side. So we're first going to just passively assess his movement both directions. You can see at the end she's pretty stiff in and limited in that movement. So first we're going to work on wrist flexion, okay? So thinking of the convex concave, we're going to be working on this movement here, okay? So I can find where those limitations are. I'm going to do grade 3 and grade 4 mobilization. I'll come out here just a little bit just for the advantage of it. So I'm going to stabilize her wrist here just fine. So going to that end range. So grade 3 would be large auscultations. And then grade 4, which would be end range. So really using my thumbs to apply that force. How she's going. For wrist extension, it's similar. Again, I would probably have it more of this position, but my back would be to the camera. So we're going to put her in a little bit of abduction. I'm going to see where that range limitation is, using my thumbs to stabilize the distal ulnar radial joint. Go to that end range. For grade 3 auscultations, go through the last 50% range of motion. And grade 4, really working on trying to get that end range. Right, and you assess it afterwards. For this last component, I'm going to work on some ulnar and radial deviation. I don't have a wedge here, so I'm going to support it this way. We're first going to do some radial deviation. Okay, so I'm going to first assess to see where that limitation is. This case study didn't necessarily specify what the limitation was. I'm going to really work on getting a good grasp on both sides here. And really work on providing some movement. So here we go. So going and getting that here, that downward force. Grade 4, going to that end range of motion. And then radial deviation would be the opposite, still thinking about the alignment of the proximal carpal bones for the ulnar deviation. Thank you very much. Have a good day.